And so again, thank you for joining me this evening. I am Brian Sanderoff. I'm your host. I am a regularly trained pharmacist who at some point in my career decided that giving people medicines to help fix their problems, especially for the chronic diseases that we all try to avoid as we get older, really wasn't helping them, wasn't making those problems go away. All it was doing was turning the volume down on what the body was saying. And so at some point, probably around 20, 22 years ago, I decided that I wanted to find a different way to help people and started to seek out different understandings. A big part of the work that we do here is to help educate people. I have been known to say that the number one killer in this country is not cancer, it's not cardiovascular disease. The number one killer in this country, literally, is misinformation. It's all of those things that we're taught that are just out and out wrong. And so these webinars that I do are designed to help um, people understand that fact and to learn a different way to look at health. And that's the purpose here. It's about education. It's about learning how the body really works and helping you make more informed decisions. You know, if you decide that you want to do something, eat something, have some sort of activity, and you don't understand the ramifications of that decision, then that's a shame. And so, if once you understand the ramifications of those decisions, you decide that you still want to do it, I think that's great. You know, we're all adults, and well, most of us, anyways, and have the opportunity to make informed choices about ourselves. So, I don't know that there's anybody out there in the world who doesn't understand that smoking isn't good for you anymore. And so, if you still decide to smoke, it's your free choice to do so. Well, my contention would be that there's a lot of things that we do in health under the impression that it's actually healthy for us when it's not, or vice versa. And that's what I try to dispel the myths about. So tonight we're going to be talking about thyroid, understanding thyroid function, and a holistic approach to adjusting that thyroid function. And again, I just want to remind people, especially if you're new to this forum, that right on your control box there is a question box that you have the opportunity to ask me questions as we're going through this webinar. So if something comes up, you have a question about something, if I said something that wasn't clear or needs clarification, or if you have another question, just type it right into the box. As soon as you do that, I see it. And then I have the opportunity to answer it right then and there if it's appropriate to do so, or if I know it's going to be addressed later in the presentation, then I will address it when it happens. So let's go ahead and get started. It looks like we got, like I said, a nice crowd forming here. So understanding thyroid function, a holistic approach. So number one, let's talk about prevalence. Does anybody in there have any idea what percentage of the population, of the adult population in this country, actually has thyroid issues? It's actually a lot higher than I would have thought or guessed. And it's actually upwards of 25% of the adult population. So that they have some either a clinical or a subclinical thyroid issue, and usually it's about low thyroid function, and we'll talk about that in a little bit. Um, and actually, those numbers are likely significantly higher in elderly because hypothyroidism is much more common as we get older. Hyperthyroidism and overactive thyroidism is much less prevalent. And the other thing that's important to understand is that thyroid hormones can affect virtually everything in your body. They regulate metabolism in every single cell in the body. So practically every bodily function is or can be affected by the thyroid and thyroid function. So let's start with a little anatomy and biochemistry. The thyroid is this butterfly-shaped gland which sits low in the front of the neck. If it is a normal size, you should not be able to feel the thyroid from the outside. You only can feel it as it starts to get bigger for various reasons. The thyroid is rich with blood vessels, and as people also understand, the the nerves that go for the voice box go through the thyroid. So sometimes when thyroid surgeries have to happen, sometimes voice box gets affected. So the thyroid secretes various hormones. The two ones that we're most concerned with are called T3 and T4. So T4 is also known as thyroxine, and T3 is also known as triiodothyronine. Both of these are made from a simple amino acid, which is called tyrosine, and a mineral that you guys know of that's called iodine. 80 or 90%, from 80 to 90% of what the thyroid releases is actually T4. Now, T4 actually can be thought of as sort of like a pro-hormone, which means that in the body, it gets converted into T3 by the peripheral organs like liver, kidneys, spleen. And T3 is really the active thyroid function that has the hormone that has its function in the body of metabolism. Right? So this story starts with a different gland in the brain, which is called the hypothalamus. And the hypothalamus makes a messenger, which we call TRH, which stands for thyrotrophin releasing hormone. That, in turn, goes to the pituitary gland, also in the brain, and that causes the making and the release of another sort of messenger called thyroid stimulating hormone, TSH. And many people who have thyroid issues have heard of this because that's one of the things that we test in blood. Thyroid stimulating hormone, just like it sounds, goes to the thyroid and stimulates the production and release of those two hormones that we talked about, T3 and T4. Again, 80 to 90% of the thyroid that's made in the thyroid gland, the hormone, is actually in the form of T4. And the significant thing about this picture here is that there is this negative feedback loop. That's what these little negative signs mean. There's this little negative feedback loop to the hypothalamus and the pituitary. So when the thyroid makes its hormones, T3 and T4, the message gets sent back to those two glands that the thyroid has done its job and don't keep stimulating it to do its job, if that makes sense to you. And then I also want to point out that there is a very important connection here between certain glands and your adrenals, which have to do with stress. And so the hypothalamus, again in the brain, is sending messages to the pituitary, same place that makes the thyroid stimulating hormone, which sends a different messenger to the adrenal gland to make cortisol. And when cortisol is made, that down-regulates or alters the regulation of hypothalamus and pituitary. And this is really important to understand because when we're under stress, we are adjusting the way the hypothalamus and the pituitary act. And when that happens, that affects thyroid function as well. And so this is the connection between these glands and the thyroid, and how ultimately stress, to some extent, ends up affecting and controlling thyroid and thyroid function. And that's a really important point to get that medicine just doesn't seem to understand very well. Because when you go to the doctor and they do blood tests and they find out that you've been having symptoms and they do blood tests and you find out that thyroid's not working the way it's supposed to, then what they want to do, is we'll discuss in a little bit, is treat the thyroid instead of really looking at what else could be affecting that thyroid function. And stress and adrenal function and the making of the hormone of stress, which is called cortisol, is a major contributor to thyroid dysfunction. And so lots of times when we go to the doctor and we're told that we have a thyroid problem, really it's a stress problem. When it comes to thyroid function, you can either have too much or not enough if there's a problem. So we call that hyperthyroidism, where you have too much of the production and the function of the thyroid, or there's hypothyroidism, which is not enough function. And so we're going to talk about hyperthyroidism first. It's very rare. It's more rare than hypothyroidism. It's relatively rare compared to. So I'm just going to talk about that a little bit. So hyperthyroidism. What are the symptoms of it? Well, there's a whole bunch of symptoms that are associated with a thyroid that is functioning too much. Number one is protruding eyes, and maybe you've seen somebody who has a hyperthyroid and they look like their eyes are bulging. Nervousness, irritability, anxiety, sweating, palpitations, not being able to sleep, weight loss, especially unexplained weight loss, And then frequent stools. Now, some people call this diarrhea, but there are times when the stool is formed, but it's still happening too much, and so that's why I put frequent stools on there instead of diarrhea. With hyperthyroidism, so, some little fun facts here. Number one, it's more common in women than men. Basically anywhere from 8 to 10 to 1 in women versus men. It oftentimes is associated with some sort of recent stress that seems to bring it on. And that stress can be, the death of a spouse, the ending of a relationship, moving, retirement, something like that. There's a genetic component to it as well. Interestingly enough, it's much more common in people that have left-handedness, that are left-handed. And there can be some toxins that are associated with hyperthyroidism as well, including some metals like mercury and cadmium, as well as even some prescription medicines. What causes hyperthyroidism? Well, the number one cause is actually an autoimmune disease, which is called Graves' disease. And, some up to 85% of all hyperthyroid cases really is about Graves'. You can also have thyroiditis, which is just an inflammation of the thyroid, and for some reason the thyroid gets irritated and starts overproducing thyroid hormone. You can have toxic nodular goiters, and there are various sorts of cancers that can be related with this. And actually, hyperthyroidism can be iodine induced as well if you are getting too much iodine, which doesn't happen very often. It's, far and away we are iodine deficient, not getting too much iodine. So that would really only happen in cases where people are supplementing and they are over supplementing. What kind of treatment do we use for hyperthyroidism? So in the medical world, they either use drugs that inactivate the thyroid, and there's two in particular that they will want to try to use. And what they do is they basically, let's say, poison the thyroid, but they inactivate the thyroid. Or you can use radioactive iodine, which basically does poison the thyroid. I mean, you take iodine, you treat it so that it's radioactive, and then when it's consumed, it actually finds its way to the thyroid and starts to destroy tissue, and that can stop the thyroid from functioning. Sometimes people that go through that treatment, it goes too far, and then they have to end up being treated for underactive or hypothyroidism. Or you could have the thyroid removed, which obviously is a radical step, and will then require somebody to be treated with medicine to help emulate what the thyroid does. If we were to look at treatment for hyperthyroid from a holistic approach, it's a couple things. Number one, I put vitamin D down here, and that's because it is a common occurrence in all autoimmune diseases, including Graves' disease, that those folks have low levels of vitamin D. And so to try to fix that, we oftentimes supplement with vitamin D. And we like to test vitamin D levels, blood levels, so that we can make sure that those blood levels are adequate for the body's needs. Adrenal support, and again, because of the whole link to stress, like I said earlier, oftentimes hyperthyroidism is preceded by some sort of stressful event. It could be a knockdown, drag out flu. It could be, like I said, the death of a loved one, or moving to a new place, or the ending of a relationship, retirement even. And so there are herbs that support the adrenal glands that calm the adrenal response to stress. And then number three, there are specific herbs that are known to help calm an overactive thyroid. And I wrote them there: bugleweed, motherwort, lemon balm. And so there are herbal tinctures that are combinations of those three herbs together. And that's sort of a classic recipe for hyperthyroidism. So if you have any questions about the hyperthyroidism part, then now's a good time to sort of type that into the box for me. It is much, much, much more common to have a sluggish thyroid than an overactive thyroid. And so I'm going to use the majority of the time tonight talking about the hypothyroidism, or an underactive thyroid. Hopefully I'm doing okay so far, and you guys are getting all this. So let's talk about hypothyroidism and the symptoms. What kind of symptoms? Now, if hyperthyroidism caused body, weight loss and caused nervousness and excitability and inability to sleep, then one would assume that the symptoms that go along with an underactive thyroid are just the opposite. And in fact, that is the case. So, weight gain. Oftentimes, people that have an underactive thyroid have a hard time maintaining their weight. Doesn't matter. They exercise, they eat properly, and they still are gaining weight or can't lose weight. Fatigue is a real, classic sign of that. Headaches, baldness. I like to mention to people that the hair growth issue, there is a signature event that happens, especially with women that have a hypo or an underactive thyroid, and that is they start to lose the hair on the outer third of their eyebrows, and not by plucking it, by it happening automatically. And so that's a real hallmark of this. Intolerance to cold, memory issues, menstrual issues, elevated cholesterol, a slow heart rate, dry skin, constipation, depression are all classic signs of hypothyroidism. Now, that list is quite a list, and there are also, literally hundreds of other conditions that can lead to similar sort of symptoms. And so we don't want to just say because someone is depressed or because they have intolerance to cold that we don't just want to assume that it's their thyroid. Their thyroid is probably involved, but it would be good to do some testing to find out exactly what's going on as well. Um, Hypothyroidism is much more common than overactive thyroid. And I also like to point out that blood tests don't necessarily tell the whole story. There are a lot of people who are walking around with what we consider to be subclinical hypothyroidism. And that's where you can have all symptoms or a combination of those symptoms, but that when blood tests are done, the blood tests show things to be in the normal range. And we'll talk about the testing of blood in a little bit. So, what causes hypothyroidism? Well, there are a lot of different reasons why the thyroid um, cannot be functioning properly or could be, sluggish. Um, and it has to do with those glands and where the anatomy and the biochemistry in the body. So you could have a lack of pituitary stimulation. And again, the pituitary gland is the one that makes thyroid stimulating hormone. And this is where cortisol from stress can actually play a role, right? You could have a defective hormone synthesis, and this could be within the thyroid gland itself. And so this could be nutritional. It could be that there's actually some uh, needed nutrients that aren't available so that the body can't make the thyroid hormones the way it's supposed to. Um, there could be impaired cellular conversion, and this is really a huge consideration that medicine just seems to miss a lot. As I told you, the thyroid mostly makes and releases T4, which is not the active thyroid hormone. It's a prohormone, and it has to be converted throughout the body into T3, and then T3 has its effect on cells and metabolism. And if there's a problem in converting T4 into T3, then giving T4 as a medicine, which is what we do, that's what Synthroid is or levothyroxine, wouldn't expect that to be really helpful. And that's why so many people have experienced being told they have a thyroid issue, getting on one of those thyroid hormone pills, and not feeling any better. Also, want to point out that there's an autoimmune aspect to this, and that's called Hashimoto's. And so, just like there's an autoimmune aspect to an overactive thyroid, there is an autoimmune aspect to an underactive thyroid as well. And again, it's called Hashimoto's disease. So, let's talk about blood tests for a while. The typical test. So, typically, what the doctor will test for you is your thyroid stimulating hormone, and that's the TSH. And it's common, you see that on your blood test. And that's looking to see if the thyroid is being, quote unquote, asked to make more T4 and T3. You also can test for T3 and T4 levels in the blood. However, it's important to understand that throughout the blood, as T4 and T3 are circulating throughout your body, they're oftentimes bound to various substances. And in fact, not oftentimes, but mostly bound to various substances or proteins, which render them sort of dormant or inactive. So if your doctor does a blood test for T3 and you get a number, you really don't know how much of that T3 is quote unquote free or not bound to a protein, which is then available to be used by the cells. And so it really is better to get free T4 and T3 tested. That's how you know whether there's enough of that hormone going around in your bloodstream to be used and to sort of spark metabolism and function in all the cells in your body. So really, if we want to test for thyroid function completely or more completely, what we want to do is test for TSH, which is thyroid stimulating hormone, and then also free, F-R-E-E, free T3 and free T4. When we get that information from the blood, then we can get a much clearer picture of what's going on with thyroid function. And Susan's asked a question is, what's the test that we should get in lieu of the TSH? So it's the combination of those things, TSH, and then the free T3 and the free T4. And of course, Suze, you're welcome. So there's situations that relate to and coordinate to different conditions or give us information. So if you have a low thyroid hormone, meaning that the blood test shows that the free T3 and free T4 are low, and the thyroid stimulating hormone, the TSH, is elevated, this usually means that the defect is in the thyroid hormone synthesis, actually making the hormones. And there could be different reasons why that can be a problem. If you have low circulating hormones, again, the free T3 and T4 is low, and the TSH is low, then that usually means that the pituitary gland is responsible for the low thyroid function, and that's where the attention needs to be put. If you have normal thyroid hormone and TSH levels combined with low functional thyroid activity, meaning that you have a low basal metabolic rate or a low temperature, or showing other symptoms of thyroid function, even though the blood test says that things are normal, this usually means that it's a cellular hypothyroidism, meaning that the issue is that the body is not converting T4 to T3 very well. It means the pituitary is working okay, it means the thyroid's working okay, but the conversion to T3 isn't happening properly. And again, that can be nutritional. There are certain nutrients that are needed for that to be able to happen properly. I know that's a lot biochemistry, but it's important to understand that to know how to treat this from a holistic perspective. So what kind of treatment will we do? Well, in regular medicine, what we would do is treat with thyroid hormones from the outside world. And there's a bunch of different ways to do that. So the most common way is to use levothyroxine or L-thyroxine, or the brand name for that, most popular one, is called Synthroid. This is actually T4. And so the idea is that if you take this T4, if the thyroid is not making the hormone appropriately, and that would be indicated by an elevated thyroid stimulating hormone, meaning that you're detecting that the body is constantly telling the thyroid, make more hormone, and also indicated by low blood levels of those hormones, because that's what, if those levels were adequate, that would be the signal to the pituitary to stop telling the thyroid to do its job. So the thyroid stimulating hormone would be low. That would be an indication for taking this medicine. But what if the problem isn't in making T4, but in converting T4 to T3? If all your doctor is testing is the thyroid stimulating hormone and that's elevated, then they're missing the point, because if you do that, but you also see that T4 levels are fine, that the free T4 is actually high, that's an indication that there's a conversion issue, and giving more T4 isn't going to make anybody feel any better. It's not going to change anything as far as the function goes, and that in practical terms, is what happens all the time. Can't tell you how many patients I have that have thyroid issues. They show symptoms of a hypo or a sluggish thyroid. They go to the doctor, they get the blood test, and the blood test, what they look at is the thyroid stimulating hormone, which is elevated. So they just throw them on Synthroid and they don't feel any better. There are more natural prescription medicines to help treat, which are actually glandulars. They're actually ground up, desiccated, or dried thyroid gland, usually from pigs. And there's two brand names for that are common. One of them is called Armor Thyroid, and the other is called Nature Thyroid. The interesting thing about these is that these prescription medicines contain both T3 and T4. That's really important because if the problem is a conversion from T4 to T3, this helps to alleviate that some. And the glandular also contains other nutrients that help with the conversion and the construction of these hormones. And so oftentimes people will respond better clinically to one of these natural glandular products, also still by prescription, than they do to Synthroid. There are doctors out there who won't prescribe these medicines because they're glandulars. They're not as controlled with their amounts of the of the hormones that are in there, and they think, well, that's a bad thing. But actually, in practice, many doctors have found that using either Armor Thyroid or Nature Thyroid gives better clinical results regardless of what the blood test shows. Okay, so in regular medicine, we treat it with replacement hormones. What would be the holistic approach to treating an active thyroid? And this is sort of the meat of the discussion tonight. And number one is that there are many, many, many considerations here. And all of these things need to be evaluated appropriately. So let's talk about diet and potential food sensitivities first. So the connection here has to do with autoimmune disease and gut permeability. If you guys have heard me speak before or read my my writings or have perused the website, you've heard me speak about leaky gut a lot. And that's what we're talking about here. So there is a clear correlation between food sensitivities and autoimmune diseases, especially to gluten, which is a protein that's in certain grains: wheat, oat, rye, kamut, spelt, and barley. And there are many ways that the food industry hides gluten in things as well. And so I really encourage people to explore the possibility of going on a gluten-free diet for 6 to 8 weeks and see what happens. And I've had a lot of patients with sluggish thyroids and all the symptoms that can go along with it, whether it's depression or weight gain or lethargy or fatigue, and had those problems get better, sometimes markedly better, in a matter of weeks when avoiding something like gluten. I also want to point out that stress plays a very important role here, and not just in how cortisol affects pituitary function, which I had showed you earlier, but also gut function. And here's the connection. Stress causes, and cortisol causes, some physiological changes. One of those physiological changes is a shunting of blood to the organs that are needed in a time of stress. So when we were cavemen and a saber-toothed tiger jumped in the cave, blood shunted from the gut because in that emergency situation, digestion is not job one. Job one is either running away from that predator and or fighting that predator, fight or flight, right? And then also preparing to repair the damage that's going to happen from that encounter. So blood is shunted to muscles, blood sugar is elevated, blood pressure is elevated, heart rate is elevated, immune system is buoyed. Now, when we're under chronic stress, what it means is we're constantly shunting blood away from the gut and gut tissues. And when that happens, then those gut cells, because blood is shunted away from them, they don't get nutrition the way they're supposed to. Then those cells don't reproduce the way they're supposed to. And the gut cells cannot work as the gatekeeper that they're supposed to be in determining and allowing what is supposed to be allowed into the body and what isn't. That's called leaky gut. So what happens is that you eat a gluten-containing food. Because digestion is not working properly, you only partially digest that gluten protein. And because leaky gut exists or the gatekeepers aren't working as well as they're supposed to, that partially digested protein gets absorbed. It should never happen, but it does. And when that happens, the immune system says, I don't know what that is, but it doesn't belong here. And it kind of goes ape. And part of the response of that ape is it starts to eat away at other proteins that may look similar. And in certain susceptible individuals, that means starting to affect thyroid function. And it can show up as Graves' disease, which could be hyperthyroidism, or it could show up as Hashimoto's disease, which could be hypothyroidism. So one of the considerations here with hypothyroidism and a treatment is to really take a hard look at the diet and potential food sensitivities. Now, I will tell you far and away the most common sensitivity that gets missed is gluten. Now, sometimes people will say to me, well, we can get tested for that. We do have testing for that. But I don't think that testing is sensitive enough to find the gluten sensitivity in us. Or another way to say that maybe is that there are many of us who are walking around with a subclinical celiac disease. And so I have a load of patients who have been tested for gluten. They tested as not being positive for that test, meaning that they're not gluten sensitive. And yet, when they got gluten out of their diet, life changed dramatically for some of those people. And one of those changes can be thyroid and thyroid function and how it works. So hopefully that makes sense to you. Another consideration is hormonal considerations. This is interesting. So there's a little creature called TBG. It stands for thyroid binding globulin. This is made in the liver, and what it does is it binds to the circulating T4. Remember how I told you that thyroid hormones can be bound to certain proteins in the blood, and if they're bound, they're not effective. They can't be used by the body. They're sort of tied up. Well, thyroid binding globulin is made by the liver. High estrogen conditions can actually lead to increased thyroid binding globulin, TBG, levels. So for women that are on birth control pills, that can affect the amount of circulating T4 that can be used or converted into T3. And so being on birth control pills is actually a risk factor for hypothyroidism. Now, for the young women that are listening here, or for women of childbearing age that are using birth control pills, it is a fairly common occurrence to go to your doctor, be sluggish, have problems, they check thyroid, they say, oh, you've got a thyroid problem, and put you on Synthroid, which is T4, which is just more T4 circulating to be bound up by that TBG, which is not going to make you feel any better. Also want to point out that it's not just birth control pills. Estrogens from the outside world, they're called xenoestrogens with an X, come from plastics and flavorings and pesticides and colorings. Those can also spark increased production of the TBG, which can then, in effect, bind up more of your thyroid hormone and then keep the thyroid from functioning the way it's supposed to. Kind of makes sense, right? Interesting. There are some nutritional considerations which really need to be looked at seriously. And so there are primary nutrients that are needed to make thyroid hormones. They're called iodine and tyrosine. So iodine is a mineral that we do not get enough of, and tyrosine is an amino acid. And both of those things need to be available for the thyroid to function properly and to be able to make the thyroid hormones. And they have to be available for the conversion of the thyroid from hormones from T4 to T3, from the inactive to the active. See, I got a little question coming in here from Lori, and she said, so if your thyroid is removed and you take Synthroid, does that mean that the T4 never converts to T3? No, it does not mean that. there are certain nutrients that are needed to convert T4 into T3, and they do not have to do with the thyroid producing it. But it would be better for you to take, for a person to take a supplement, a prescription medicine that contains both T4 and T3. That would be more effective to help emulate how the body works. Hopefully that makes sense. Thanks for the question, Lori. Appreciate it. So we don't get adequate amounts of iodine in our diets, and I'm going to do I am going to do a webinar about iodine at some point, probably in the fall, because there is a lot of misinformation about it. There's a lot of misunderstanding about it, and just like we used to think in medicine that vitamin D, all you needed is 400 units or 800 units or whatever. The RDA vitamin D is woefully low, and it's the same thing with iodine. And your body, a lot of cells in your body need iodine to function. The thyroid gets first priority to it. And so when you are deficient in iodine, the thyroid sucks up whatever's available and tries to use it. And then all of the other cells in the body go wanting. And some important cells that also have a priority for iodine are breast tissue, uterine tissue, prostate tissue, and immune function. And so actually women that have fibrocystic breast and fibroid tumors in their uterus oftentimes are iodine deficient. Here's an interesting little fact. Now, you can get iodine from your diet. Women, people in Japan, inhabitants of Japan, actually get about 12 to 12.5 milligrams of iodine every day. Here, the RDA is 150 micrograms, and so that's like 100 times less. In Japan, they get that much iodine because they have exposure to sea vegetables, and their land is irrigated, gets irrigated from the rains that come from the sea, that then replenishes the iodine into the land and then gets taken up into the vegetables that they eat or the animals that eat those vegetables. And they have much lower incidence of breast cancer and all sorts of other, health issues. We've looked in the past. We said, oh, it must be the soy in their diet, but the truth is it actually it's the iodine that they get. So you get iodine from your diet. You can. Iodine also gets absorbed on your skin. And has anybody ever noticed and or observed that people that go to the shore, that go to the ocean, actually come back saying that they feel better, that they feel rejuvenated? Well, it's interesting because waves at the ocean and the pounding cause an aerolization of iodine. They actually cause iodine to go into the air. And then that iodine gets on your skin and you absorb it and you feel better. So obviously when you go to the ocean, it's vacation and you feel better from that as well. But part of that is actually the iodine that you're getting when you go to the ocean. That's why spas that are near the ocean have a tendency to, be popular without ever knowing why. There are certain foods that can combine with iodine to make it unavailable to the thyroid and the rest of the body. They are foods that bind iodine and make it so that your body can't use it. And those foods are all from one big family that include turnips and broccoli and cabbage and rutabagas and kale and mustard green and radishes and horseradish. Also soybeans, peanuts, pine nuts, and millet. Now, cooking those foods can decrease that food's ability to bind with iodine. But if you have hypothyroid tendencies, those are foods that I wouldn't say you should avoid, but I would say that you should have more sparingly. There are other cofactors that are needed in the conversion of T4 to T3, like Lori had just asked about. Zinc, copper, and selenium in particular. And so those nutrients are very important for us to have enough of. And so when you see thyroid products or products that are designed to help thyroid function, you'll see that they have tyrosine, iodine, and then also zinc, copper, and selenium in it, as well as some of the B vitamins, some other things. Pamela has asked me, can I repeat the list of foods to avoid? I absolutely can. I went a little fast with those, didn't I? Turnips, broccoli, cabbage, rutabagas, kale, actually cauliflower. I don't think I said that the first time. Mustard greens, radishes, horseradish. They're all from one particular family of foods. Um, and then also soybeans, peanuts, pine nuts, and millet all uh, have that property where they can sort of bind to iodine and make it so that your body can't use it or absorb it as readily. The next consideration has to do with exercise, and exercise actually helps stimulate thyroid secretion and increases tissue sensitivity to thyroid hormones. So this is like this is that credo in action that says use it or lose it. And so when you exercise, you're sort of instructing your body biochemically in a very specific way to increase metabolism. And when we don't get exercise, the opposite happens. So those of us that sit around in a desk all day and then go home and sit around watching TV or on the computer and we're not getting exercise, we are influencing our thyroid in a negative way. In fact, we're saying to our body and our thyroid, we don't need much metabolism going on. I'm not getting a lot of activity. Don't burn a lot of fuel. And that is just the opposite of what we want, right? And then the last consideration that I'll talk about is stress reduction. We're getting close to the end, so if you had questions that that you wanted me to address, now's a good time to start to type them in so I can answer them for you as well. So I talked about stress and the importance and the effect that stress has in a couple different ways that affects thyroid function. So number one, stress affects hypothalamus and pituitary function. And when their function gets affected, that ends up altering thyroid function as well. And then stress also plays a role with gut function and leads to leaky gut, which then can, play a role with hidden food sensitivities that can then lead to autoimmune issues, which oftentimes can play a role with thyroid function as well. So stress needs to be paid attention to, and that doesn't mean necessarily what we think of as negative stress. I mean, I think we commonly think of stress as a negative, like, okay, that was a bad thing. Well, that's not necessarily true. Those of us who exercise hard, that's a positive activity, but it actually is a stress to the body, and some adrenal support is appropriate and called for in that situation. Here's another thing that isn't commonly thought of, and that is sleep apnea. Not oxygenating your tissues properly when you're sleeping is tremendously stressful to the body and can be the direct reason why you can have high blood pressure and sugar issues, especially early in the morning. And so those of you that are adult onset diabetics that eat the way you're supposed to and exercise the way you're supposed to, and when you test your blood during the day, everything's great. But when you wake up in the morning and the first thing you do is test your blood and it's elevated, it's likely that sleep apnea is playing a role. And the same thing with people that are, have high blood pressure, hypertensives. Same thing. You go through the day and blood pressure's fine, but when you wake up in the morning, it's elevated. It's likely that sleep apnea is playing a role with that. So there are a bunch of herbs and nutrients that help calm the adrenal response to stress. They help nourish the adrenal glands. And there's a bunch of activities that we can either do or avoid that affect stress, adrenal function. So number one, something to avoid is caffeine and caffeinated, foods and beverages. Number two is you got to quit skipping breakfast. And when you are eating breakfast, you shouldn't be eating processed and refined carbs. That means cereal. What you should be eating is protein for breakfast. That's very, very important. Let's see. Lahan asks a question here, and that is it true that radioactive drug to treat thyroid problems can affect people near them, especially children? It's really interesting that you asked that because, yes, that can happen. We use radioactive iodine to help, treat an overactive thyroid. And yes, I believe that people that get that treatment for a period of time are told to not have close contact with, people of childbearing age or children or pregnant people. It's the same thing for the radium seeds that's used for, prostate cancer in men. And the reason I giggled a little bit about that when you asked is because I have a brother-in-law who just got treated for prostate cancer with the radium seeds, and he actually was told, and we had a family event where my daughter-in-law is pregnant, and she couldn't come to it because of that potential exposure. So it's interesting, and yes, it is a concern. Any other questions? Now's a good time to type them in. I want to tell everybody about what's coming up in the next couple months. I'm excited about the one in July. This is a topic that I've been wanting to cover for a while, and I call it a balanced discussion about vaccines. And so I say balanced because I don't want to scare people away to think all I'm going to do is say, oh, vaccines are evil. What I'm going to do is talk about what we really know about vaccines, whether they work or don't work, especially like the new ones, like the shingles vaccine or the vaccine for pneumonia, as well as childhood vaccines. And, really, is there a connection between vaccines and autism? And does the flu vaccine really work, and all that sort of stuff? So we're definitely going to talk about that. And then the next month, I'm going to talk about vitamin K, the untold story of a vitamin superstar. Vitamin K really is another one of those very important nutrients that we're going to talk about in August, and I'm really excited about that as well. Okay, a bunch of questions are coming in here, so let me get to them. We got Pamela said, what are the herbs and practices that can be used to address adrenal concerns in the context of hypothyroidism? Okay, so there are a bunch of different herbs. They're called adaptogens. I did a webinar just about stress, and we go into those in much more detail in that webinar. It's on the archive. But we're talking about things like ginseng and licorice, and ashwagandha, schizandra, arctic root. There's a whole bunch of different ones. Lemon balm is one. And so we like to use combination products that have a group of those herbs together. And my favorite ones to use clinically are by a company called Natura. And there's two products, either Vital Adapt or Power Adapt. And so the Vital Adapt is a good general tonic. The Power Adapt is, oh, something's going on and I got to treat this stress now. And the feedback I get from using those products, and I've used them for years clinically, is phenomenal. Oftentimes people just feel like the edge is taken off. It helps increase metabolism. It helps calm thyroid dysfunction on both sides, because stress can be related to both of them. So those are the kinds of herbs. Thank you, Pamela. Appreciate that. We've got Laura says, can you finish your comments on herbs and other techniques for stress reduction? Yes. And so those were the herbs. Thank you for that. Other techniques for stress reduction. And so here's a big issue. And I work with people a lot with this. There are people who I sit down with and they tell me that it's their husbands or wives or parents or kids or bosses, and then they go out and get new husbands and wives and parents and kids and bosses, and things are the same, because really it's not about what people are doing to you, it's about how you are reacting to your environment. And so ultimately stress reduction is about learning to interact with your environment in a different way. We have a tendency to look at life events and say that was good or that was bad, that was pleasurable or that was painful. And the truth is that that's a determination that we make in between our ears. And so if we can learn to look at life situations and say, isn't that interesting, instead of isn't that good or bad, that completely changes the chemical response that we have to whatever is going on. Also, the other technique is about learning to live in the moment right now. We spend a lot of our time worrying about what happened yesterday or what's going to happen tomorrow. And the truth is that those are things that, again, we make up in our minds. Let's imagine we have somebody that hates to go to the dentist, and in 2 weeks they have a dental appointment. And so they could sit around for 2 weeks and say, oh my God, I got to go to the dentist. I hate going to the dentist, the drill and blah, blah, blah. Well, the body doesn't recognize that you're not actually in the dental chair all that time. It's like projecting a movie onto a screen, and the body thinks it's actually happening. And so the technique is to say, you know what, I hate going to the dentist, but right now I'm not in the dentist chair. Everything is perfect right now. I'm safe, I'm happy, I'm content. And that changes everything that's going on inside chemically. We have a great practitioner in our office named Randy Botnick, who is a clinical hypnotherapist and an amazing sort of energy worker and spiritual counselor. And she is really good at helping people learn new techniques to interact with their environment differently. And for those of you that are not in the local, Baltimore area, she does a lot of work with people on the phone as well. And so that may be something to check out, you can go to the website, wellbeinggps.com, and go to the practitioner section and read about her and connect to her website, which gives you more information about the work that she does. I don't know where everybody is located, but she actually is going to hit the road soon to go do some work. And she's got dates already booked in Kansas City or Lee Summit, and then also out in Los Angeles. So if you're in one of those areas, you might check out her website and take advantage of her work. All right, I got a question from Virginia. Will I talk about HPV vaccine? Oh, Virginia, will I talk about the HPV vaccine? Because I have some really strong opinions about that and actually have a patient whose daughter died from that vaccine. I did a whole 2-hour radio show about this once upon a time. And so, yes, I am going to be talking about HPV as well. Let's see. What about Cytomel for T3 supplementing? This is from Roberta. So good question. So Cytomel is a prescription medicine that is solely T3. The issue with using that is that T3 is not as long acting and long living in your body. And so when you use that as a prescription medicine, you have to be very precise about the timing of taking it. And it is much harder to manage. So I'm not saying it shouldn't be used, but I'm saying it is more difficult to use it appropriately. So that's why I like the natural combination products like Armour Thyroid if needed. Thanks for the question. I got Ralph asking, are there other blood tests or additional tests that can narrow down to see if one has adrenal stress? Yes, really good question. So first of all, usually just sitting down with somebody and asking a few questions lets us know whether stress is there and its effect in the body. But if we really want to know, what we want to do is get a look at cortisol levels in the body over a period of time, over throughout the 24 hours of a day, because cortisol levels are designed to be elevated in the morning when you wake up. That's part of what wakes you up in the morning and gets you moving. And then you get a nice smooth curve going down, and then it evens out to low levels at night. And that's what allows you to settle down and sleep. And so we do saliva testing where you spit in a tube 4 different times during the day, and then we send it off, and they measure the cortisol in the saliva. And that's the most accurate way to see what cortisol levels are. And then we can see whether that curve matches what it's supposed to. And that gives us a good sense. Now, generally speaking, as a practitioner, I would much rather see you keep your resources for use in ways other than testing, if possible. And so, like I said, when I sit down with somebody and we talk and, I ask a few questions, it's real clear what role stress is playing in life. And, I often find it unnecessary to do testing. Thanks, Ralph. I appreciate that. We got Tom asking, can Synthroid be completely replaced with holistic approach? My wife had her thyroid removed years ago and stays on Synthroid. Is there an alternative? When the thyroid is removed and there's no hope of the thyroid being able to do what it's supposed to do, then no, a holistic approach is not going to replace that. There may be, like I said, it may be better for her to be on Armour Thyroid or Nature Thyroid than it is on Synthroid. And there's some things that can be done to help make sure that her body is being efficient at converting T4 to T3, throughout the body, seeing to liver function, gut function, all those sorts of things. But once that thyroid is removed, we have to replace it chemically. There's just no other way around that. Thanks for the question. We got Nancy. How do I access your archive? Go to wellbeinggps.com, and right on the front page, it'll have a little button to punch that says about our webinars, and then on there you can see the archives. And like I said, there's about 18 or 20 different titles up there now, including things about stress, weight loss, getting a good night's sleep, cholesterol, osteoporosis, depression and anxiety, menopause, vitamin D, fighting the flu, all sorts of things. So I've had a good time doing these, and they're all there. Let's see, Ralph. Nature Thyroid versus Armour. Any differences, or one better than the other? Compound versus pharmacy prescribed. Okay, so I'm not crazy about the compounding just because it becomes much more expensive, and there's no reason for that expense. Armour Thyroid and Nature Thyroid are pretty much equivalent. Armour Thyroid had a problem in their manufacturing a while ago. It's probably, 5 or 6 years ago now. And for the FDA got on their case about some irregularities in the product, Nature Thyroid, that never happened. They're both available now. So some doctors like to prescribe Nature Thyroid. I think that for all intents and purposes these days, those things are equivalent. Ralph is also asking what levels of vitamin D are required. So I like to see a blood test, and I like to see that blood level up into the 50 or 60 range. For many of us, it requires 5,000 units a day. And that's what I take every day, 5,000 units of vitamin D. At this time of year, I might start to tone that down a little bit if I'm going to get some exposure to the sun. But it's best to have that blood tested so that we can see exactly what that is. Got a question from Laura. What are my thoughts on compounded T3 to better regulate T3 levels? Again, there's this thing called Wilson's syndrome. I think that I have an article about that on the website that I wrote a while ago. And with that understanding, you use T4 and T3 in very specific ways. And so it's fine to do it. Again, the compounded stuff becomes much more expensive because it's a labor-intensive practice, and so it becomes more expensive, basically about $1 a pill, a capsule, or a tablet. And there are issues with having to take them at certain times. And so I've seen regimens where patients were on T3 compounded or the Cytomel, which is the prescription medicine, the one that's already made up. And you have to take it at 6 in the morning and 6 at night, and that means that you have to take it at 6 and 6. You can't take it at 5:45 and 6:45. And so, because of the need for being really neurotic about when you're taking it, that ends up being a problem. Thanks for that question, Laura. And then we got Ralph. Are cortisol supplements in conjunction with the use of Armour helpful? Oftentimes, very, very helpful, Ralph. And this is where medicine misses the boat in not recognizing that adrenal function and stress really affects thyroid function. And so when you have a thyroid issue and you're taking a thyroid medicine and you're only getting somewhat of a result or an incomplete result from that, it's likely because we're not putting any attention to the adrenals, and that's what we need to do. So I would recommend that, happy to sit and talk with you and go over this with you. And that goes again, that goes for anybody that's on here tonight, basically anybody in the world. You're more than welcome to call me anytime. You can do that by finding the number on the website, or you can email me right through the website. And I'm really good about getting back to people and happy to try to help you answer these questions for you as an individual. And that really is important to understand, is that when we give information about this is general information. And sometimes we need help. Lots of times we need help in applying that information to you as an individual, because you are a unique individual, and your family history and your way of interacting in the world is different than everybody else's, and that affects and can change how we would address a certain thing. And so we like to be as complete as possible. And so part of the work that I do, part of my mission in life, is to be a resource for people, and I do encourage people to take advantage of that. Call, ask questions, whatever. How does one know what dosage level of Armour is correct? That is going to come from experience. And that means that we need to see the clinical results. You can't necessarily rely on blood levels to tell you whether something's appropriate or not. It really is there are some general guidelines that physicians should have or know for conversion from, say, Synthroid to Armour Thyroid. But it becomes a little bit of a trial and error as well, where we try generally a middle dose, and we try that for a bit and see what kind of results we're getting. And if things seem to be getting better with energy, weight loss, fatigue, sleep, depression, that kind of thing. And if not, then we might adjust the dosage up a little bit until we start to get the results that we're looking for. Boy, that was great. What a bunch of questions. I really appreciate that. And I appreciate everybody joining me tonight. I can't tell you how much I honor your willingness to spend some time with me, some of your hard-earned evening time like it was tonight. And I hope that it's been useful for you. And I do encourage you to join us again. And thanks for your attention, everybody. We will see you next time. Everybody have a great, great evening.